Hello to our audience in Mexico and in Europe. I'm Érika Ruiz Sandoval, and I welcome you to the 6th online edition of the EU-Mexico Think Tank Dialogue Initiative. Today, we will be talking about one of the most concerning consequences of COVID-19, the increasing inequality and its pernicious effects on vulnerable groups. This has affected the whole world, but we're going to talk especially about the cases of the European Union and Mexico. Some have said that this health crisis has put us all in the same boat. But no, we're not in the same boat. We are in the same storm, and many hardly have a boat, and that is a big difference. As the UN Deputy Secretary General Amina Mohamed said, the COVID-19 pandemic has swept across the developed and developing world, exposing the frailties and inequalities of our societies. These inequalities have reflected from access to universal social protection policies to national financial packages to save the economies. Even before the global pandemic, gender, age, disability, employment status, and citizenship had implications for pay and income, as well as for access to welfare, health, and education services. Unfortunately, in the current global scenario, these elements will affect mostly and more profoundly the most vulnerable. For example, all over the globe, specific populations such as migrants and refugees are at an increased risk of contracting diseases, including COVID-19, due to the overcrowded conditions they usually live in and the fact that they generally have experienced greater income loss, healthcare insecurity, and difficulties linked to the uncertainty in their legal status. This dialogue will analyze how the COVID-19 crisis is exacerbating inequalities in the European Union and Mexico. The exchange aims to throw some light on possible areas of cooperation between both partners. And this will be particularly relevant as Mexico and the European Union have committed to working towards the accomplishment of the Sustainable Development Goals of the 2030 Agenda and have just concluded the modernization process of their global agreement, which explicitly reaffirms the support for this global agenda. To better understand what are the main impacts this health crisis has brought to both the European Union and Mexico, in terms of inequality and especially the effects of COVID-19 on the most vulnerable, we will talk with Ana Ayuso Pozo, researcher on Latin America at the Barcelona Centro for International Affairs, CIDOB, since 2002. She was the coordinator of the International Cooperation Area from 1996 to 2002. Roberto Cortinovis, researcher in the Justice and Home Affairs Unit at the Center for European Policy Studies, CEPS, whose main interests are in EU justice and home affairs policies, that is, migration and asylum, border control, return, and readmission, with a focus on the EU's external action in these areas. Marcelo Delajara, who's the director of the Economic Growth and Labor Market Program at the Centro de Estudios Espinosa, Yglesias, since 2015, and a visiting professor at the Center for Economic Research and Teaching in Mexico City. And he's also the host of the Economía en Tiempo Real program in Rompeviento TV. Claudia Masferrer León is a professor and researcher at the Center for Demographic, Urban and Environmental Studies, the CEDUA of el Colegio de México, since January 2016. Currently, she's also the coordinator of the Migration, Inequality and Public Policy Seminar at el Colegio de México. Thank you all in advance for sharing your thoughts and expertise with us. As the conversation moves along, please post your questions on the online chat of this webinar and address them to a specific participant. All participants can see them, and at the end, we'll select a few of them to provide some answers. Apologies in advance if we don't get to them all. Our first speaker will be Ana Ayuso. Why is it important to discuss inequalities amid the global pandemic? How is this crisis having a specific effect on vulnerable populations? And are there any specific policies that governments should be advancing that they might be doing or not? You have 5 minutes. Thank you, Ana.
Thank you. Thank you, everybody, to be here. Thank you for inviting me to participate at this dialogue. Well, this is a big question to answer in 5 minutes, but I will do highlight some questions. Well, inequality is a global trend. It's not new. It's a global trend that has been deepening in the recent decades around the world. And Europe is not an exception. In Europe, also inequalities were growing in the last past decades, especially after the Great Recession, after the financial crisis. And the COVID is just exacerbating these tendencies and highlighting the inconsistencies of the development model and the incapability to guarantee the basic needs and protect all the people of the different countries. The virus, as we have seen, is spread in all the countries without respecting borders, but the difference is the capability to cope with this, the consequence of this disease. And we have seen in the different states in the world, but even inside the European Union, the countries that had strong healthcare services and that have the materials, that had high rates of people well trained to cope with these diseases, they had less rate of mortalities. So it's a question of life or death. And this also put into question the consequences of the austerity measures that were taken in the last decades in countries like Spain and Italy and Portugal, that now had problems to cope with this crisis, and their health systems nearly collapsed in the first days because they didn't have the capabilities. And the worst was the lack of coordination, because these differences of capacities were not put into a basket to be solidarity in between the countries, but it was really a shock, no? That in the response was very different, where each country, every country tried to save themselves, and they take different measures, they had different criteria, and that the worst was the lack of solidarity, no? The lack of response from the countries that were well equipped with the other countries, not even with the safe materials to not prohibiting the export of this material, but also now with the discussions about how we will do with the consequence after the medical crisis, and how will we pay the consequences, the social consequences of this crisis. And this is inside the crisis inside the European Union, but inside the countries we also have these problems of inequalities, no? And we can, for the moment, at the first place, it was to save life, no? To save life, it was the priority, and but now we have the other consequence, the social crisis, and the economic crisis that is having to have really problems in first the consequence of the confinement in the population, and the second one is great problem that we will face is the unemployment. Unemployment is getting in rates that was nearly when the financial crisis, but the problem is this another time, no? And we find also that these people is people that in some cases probably will not recover this employments. Some employments will disappear, and the people should be reinvented, no? The kind of population. And then we have all the problem of informal workers. The crisis put in the highlight the problem that the quantity of people that is really in an informal situation, in a precarity of jobs, that they will not have the possibility to access to the social policies. No, that this is a really great problem, especially in countries like Spain or Italy that have this tourism sector, that is services sectors that are very precarious.
Okay. Thank you very much, Ana. Marcelo Delajara, millions of people all over the world are worried that the measures taken to combat the virus will starve them before COVID-19 makes them sick because of lack of income. And that is certainly the case of Mexico. How is this reality being lived by the most vulnerable populations in Mexico? And what should be the priority policies to tackle these urgent concerns? You have 5 minutes. Thank you, Marcelo.
Thank you. Thank you for inviting me to this seminar. Well, the starting point for this discussion has to do with the official statistics of unemployment that we have. Actually, about 400,000 people lost their jobs in the first months of the pandemic. That is in the formal sector only, and estimates are that maybe another 400 or between 400 and 600,000 lost their job in the last months between April and May. But that's only the formal workers, which although they are formal, they don't have an unemployment insurance. So there's no unemployment insurance in Mexico, even for formal workers. So even if you are a formal worker, and you lost your job, you are in trouble. And at least you can keep your access to medical services for 3 months, but maybe in this situation that's too short as well. So, but this has been multiplied in the informal sector. The informal sector are people who lack social security, who usually lack savings, and usually are outside any of the safety nets in the country, which is small. I would like to quote a survey done by Universidad Iberoamericana. They have a center at CIDOB, and they estimate through a survey on the telephone that between 5 and 8 million people either lost their jobs or were granted furlough or are unable to seek jobs during the months of April. So that means that if that's true, that means that the unemployment rate for the whole population might have jumped up to 4 times the unemployment rate that we had before this crisis. About 40% of households, according to these surveys, have lost their incomes or job during these months, and this figure is much higher, closer or larger than 50% for those living in poorer households. About 62% of households have lost either incomes or jobs, in some income or job during this month. So there's a huge impact which is being felt more strongly by those who are poorer. There's evidence of an increase in food insecurity, in mental health issues as well. And the last piece of information that came out yesterday are official estimates by Coneval of the probably increase in the poverty rate in Mexico during this crisis and in the following month. And the estimate is that about income poverty, that is poverty related to the loss of labor income, might increase about 8 percentage points from 38% to 46% of all the labor force. And the extreme poverty might increase by between 5 percentage points and 9 percentage points, which means an increase between 6 and 10 million people in extreme poverty in Mexico due to this crisis.
Well, thank you very much, Marcelo and Ana, for giving us this initial perspective. Now, as mentioned before, migrants and refugees are among the most disadvantaged groups in the COVID-19 pandemic. It is the turn of Roberto Cortinovis and Claudia Masferrer. What is the relationship between migration and inequality in each of your regions? What should be the priorities to protect migrants and refugees? Do regional and multilateral cooperation play any role in advancing immediate and long-term solutions? We will start with Roberto. You have the floor for 5 minutes. Thank you, Roberto. Roberto? Okay, then we'll start with Claudia while we get back Roberto.
Yeah, we lost Roberto, but I'm happy to start. And as my colleagues have mentioned, I really thank you for the invitation, for being here to discuss something that I think is very, very important in terms of what will happen in the face of COVID-19 in terms of migration and inequality. And I have to say that I would like to start by revising very quickly what we were facing before March, before February of this year. And we have to think also that when we talk about the region, I like to think about Mexico, the United States, Canada, like in terms of North America, but also including Central America. So we need to consider what was happening in Guatemala, Honduras, and El Salvador. And in that sense, we also need to think about very different populations. So as you've mentioned, we have migrants, we have refugees, but we have different types of migrants. We have a very heterogeneous population. We have an increase of women and children that have transited through Central America, Mexico, in an attempt to arrive to the United States mostly. And just before the pandemic started, we had a population that lived in a limbo, trying to enter the United States, waiting for an asylum claim to be decided upon after the migrant caravans that increased arriving in the last year. We also have flows going south, mainly formed by returnees, deportees, and these are not only Mexicans, these are also Central Americans that go back to their countries of origin and that face different challenges. And we have then immigrant populations in Mexico, in the United States, in Canada, in Central American countries. And in that sense, we know that immigrants in the United States have been hardly hit by the pandemic. They are considered essential workers. They have, in many cases, no access to health services, access to welfare system, access to a support system that, and they're still working. They are working in agriculture, they're working in services, and they're considered essential, but they really lack protection against the pandemic. And in Mexico, we have a different situation for immigrants, but I would say that we risk to have a similar situation like the one we face in the United States if we have increasingly these populations in a limbo of legal status, right? Something that we do not want. So I would say that because we have different populations, because we have different countries with different regimes, we need to think that migration and inequality has a very complex relationship. And I have to say that we have studied at COLMEX, at the seminar that I coordinate, different dimensions of inequalities. So we have to think that on top of the gender inequalities that we usually face, or age inequalities, immigrants face different challenges. For example, immigrants usually have precarious dwellings and live in physical spaces that are very close to each other. So social distancing does not mean the same for them in the United States or in Mexico, right? Than for other populations that can actually live and social distance from others. The same thing, access to healthcare. We know that refugees in Mexico have limited access to health. We know that this same thing happens in the United States. So when we think about staying at home and maintaining basic quarantine measures to protect themselves from the pandemic, this is not always possible. And we also know that, for example, for those who are deported, who arrived to migrant shelters, some of them were infected because they were coming from detention facilities in the United States where COVID was also present, right? So there has been some importation of the virus because of deportation. And this can be problematic in the future, and I hope it really changes. I have to say that the Mexican government actually, after many different actors and activists denounced the conditions that refugees were living in Mexico, they were actually released from some detention centers here in the country. So there is some consideration about different challenges, but I'm really worried that in the long term, we will just see an increase of inequalities for all these different populations. And very quickly, just to close, I would say that at COLMEX, we're preparing a report where we're actually going to be talking about how these different vulnerable populations face COVID and will face in the future different inequalities. So this should be ready, public in the first week of June. So I would say that this is something that we will definitely be discussing next.
Thank you very much, Claudia. Now we'll go to Roberto Cortinovis. Same questions, but from the European perspective. You have 5 minutes. Thank you, Roberto.
Thanks, many thanks, Érika. I'm very happy to be part of this discussion. Yes, as it was already mentioned by Claudia, the risk is that, of course, this crisis exacerbates already existing formal and substantial inequalities within our societies. And of course, the COVID emergency can also produce a negative impact on the fundamental rights, specifically of migrants and refugee populations due to the precarious legal status and precarious socioeconomic conditions of these categories. So if we look at the situation in Europe, we look at policy responses adopted by states, member states across Europe, what emerges is a kind of mixed pictures, which include surely a set of worrying developments, but also in terms of fundamental rights, but also some somewhat surprising positive developments. So starting with the bad news, the COVID emergency has exposed the limits of previously adopted policies by the EU in the field of migration and asylum, the short-term approach of these policies, and also legitimize in some cases some restrictive measures taken by states, including limiting access to asylum, refusal of entry at the border. So these policies, which were already adopted, became even more restrictive as a consequence of, consequence of the COVID emergency. So just a few examples: the situation on the Greek islands, which was extensively covered by the news in the so-called hotspots on 5 Greek islands, where there asylum seekers staying there cannot leave the islands, are subject to a geographical limitation. And the islands, the hotspot, were in crisis well before the COVID emergency, with around 40,000 people forced to live in structures with an overall capacity of just around 10,000 people. So the conditions in the islands were unbearable. Overcrowding, lack of access to healthcare, proper sanitary conditions, which were already well known. And so the COVID emergency, of course, increases even more the risk. And the health practitioners and also human rights bodies have called on Greece and member states to evacuate the people on the island, starting with vulnerable categories as soon as possible. But the situation on the islands is just the most extreme cases of situations which are also there in other member states, where migrants, asylum seekers are detained in conditions, in settings which do not allow of respecting the precautionary measures. And it's also the case of many asylum seekers or even rejected asylum seekers and undocumented migrants which have been forced out of the formal reception system and who are living in informal settings, again characterized by precarious hygiene and health conditions. Beside that, in some cases, the COVID emergency is also used by some member states as an excuse to even tighten even more some controversial approaches. Is the case of Malta and Italy, which have declared their ports closed due to the COVID emergency to migrants rescued at sea by private actors. Because with the motivation that it would not be possible to ensure respect of health standards in their ports for preventing COVID-19 spread. So while the challenges should be acknowledged, UNHCR, Council of Europe have stated that even the public health imperative cannot be taken as as a justification for suspending fundamental rights, such as the right of asylum, which is not derogable, and to comply also with fundamental obligations under the international law and international law of the sea to save life at sea. So these are so kind of negative developments. I was saying they are reinforcing previous trends, but on a more positive note, we are also seeing the adoption of measures by some states which go in the opposite direction of less restrictive measures. This is the case, for example, of the Portuguese government, which has granted temporary residence to migrants and asylum seekers whose permit was pending, granting full citizenship right. Is the case of Italy, where a program for regularizing undocumented migrants working in the agricultural sector is ongoing. And also more broadly, some states are experimenting with new modalities of processing asylum applications with new technologies that could be used in the post-COVID phase to improve the efficiency and ensure more uniform procedures. So to conclude, I think this synthetic overview points to the fact that there are, of course, a number of concerns, but the situations also offer a window of opportunities for more comprehensive solution, and also for a more positive and less toxic narrative on migration as part of a comprehensive strategy to address this emergency.
Thank you very much, Roberto. Now I have some questions for all of you, and you'll have 3 minutes to provide the answer. As we stated at the beginning, we want to know what the European Union and Mexico can do, if they can join efforts to advance initiatives, policies, promote institutions that address inequalities and take better care of vulnerable groups. Could the partnership between Mexico and the EU engage citizens, political actors, civil society, the private sectors on both sides of the Atlantic to exchange lessons in building more equal societies after the crisis happens? What is your prediction in terms of how will this play out in the short and midterms? Let's start with Anna, 3 minutes, please.
Well, I think the main lesson from this crisis is the necessity to rethink about which is the role of the state and the public policies should have in each country, and also in regional dimension. So I think first is to restart this debate, and then to start to think how to cope with this kind of crisis, how to prevent the crisis, and how to have mechanisms to react to this situation. I think first thing is to do is to identify who are these vulnerable people. You have to map the dimension of the vulnerability now to have an answer for this situation, but to have also the capacities to design policies and medium and long term to cope with these inequalities. The second thing is how to construct a rational responses with a rational mechanism to have a coordinated action against this situation. And then I think this is now with the pro tempore presidency of Mexico, of the TELAC, I think it's one of the possibilities to rethink how to review this relation between Europe and Latin America with this vision of how to create or strengthen the capacities of the regional forums to do answers to this crisis. And I think to do that, we can take, we have a roadmap, that is the 2030 agenda. I think this can be the opportunity to reinterpret this agenda and to take it to design this cooperation between Europe and Latin America. And the other thing that I think is very important is to strengthen international cooperation instruments, United Nations. I think Europe and Latin America should work together to strengthen the United Nations system, and not only to relation to the health system, but also in general, with the reform of the United States. The reform of the United Nations.
I would like to reform the United States too, definitely. How can this play out for Mexico, Marcelo? Do we need help from abroad? Do we need best practices? Do we need to learn lessons, or do we know what to do? 3 minutes.
I think, yeah, thank you. I think that the most important lesson from this crisis for Mexico is the vulnerability of a large part of the population that is not covered by Social Security. The fact that millions of people don't have a Social Security number or a tax identification number through which they could be reached with some transfer in this situation, for example, highlights the need to expand Social Security so that it becomes universal. It's been a long time since Mexico has been diagnosed. I mean, with this need, that there's a huge need to have a Social Security system that covers everybody. And I think the European experience of the last decades of post-World War II could be very useful for Mexico. I think that could be a very profitable relationship between Mexico and the European Union, to have this target of inclusion of social protection for all the population.
Thank you very much, Marcelo. What about the European Union? Are they going to have the political will and the political capital to provide assistance to others while you face the same crisis in the European Union? Roberto, what do you think? 3 minutes.
Yes, thanks for this interesting question. Of course, I think the member states, why in the first phase they reacted in a unilateral way, to the emergency, closing borders and restricting, slowing down asylum procedures. They are now, I think I'm confident that there is now more awareness of the fact that to address this situation, this should go this should be done in a way that leaves no one behind, and that also to provide for a comprehensive response, also categories such as migrants, refugees, and should be considered, taking also into account that, of course, we are taking into account the situation of vulnerable categories, but also that migration is an important component of our societies. Migrants provide an important contribution to important sectors, including the medical sector. So this, I think, would be important also to take this opportunity to foster a more positive narrative on migration, and at the same time, for a specific task of European institutions is try to leverage this opportunity to promote a more comprehensive and long-term approach to migration. So that was not possible in the previous years due to divisions and polarization. But now the Commission is set to present a new set of proposals in the field of migration and asylum. And I think this is the opportunity to move ahead with reform in this area, including with strengthening solidarity among the member states, which has again demonstrated to be an important and necessary aspects of a coordinated EU response, also to the related consequences and implication of this situation.
Thank you very much, Roberto. Claudia, can we escape in the case of Mexico, because we seem to be trapped between the United States, with a very severe COVID-19 case, Central America with a very vulnerable situation, ourselves in a vulnerable situation. How are we going to handle this? And is Europe an inspiration of some sort?
I tend to be pessimistic in general, but I know that we need to talk about good practices and about lessons to be learned. I would say that we are likely to face a kind of like a going back and looking to the local supports, neighborhoods, and just like other actors that are not necessarily the government that will support migrants and vulnerable populations. We've seen that happen in the United States, for example, in New York, with networks of support and solidarity and providing food. And I think maybe the optimism would be found there in kind of like the neighbors and the local communities. I tend to be pessimistic in the case of Mexico because we have not seen in this current administration a large investment of migrants and refugees. We have to remember that the budget for the Mexican Commission of Refugees was terribly cut at the beginning of the administration. At the same time when the migrant caravans started to arrive and actually needed more support. So we know that the Mexican government has been very kind of like ambivalent in terms of how to deal with migration, right? So far we have no idea of how the administration will deal with returnees, with deportees, with refugees, with immigrants in Mexico. The current migration law provides access to health to migrants and everyone, but it's unclear if that will happen and if that will be the case in the future with COVID. And I would say that in terms of international cooperation, I also tend to be pessimistic because Mexico has a very complicated role in international multilateral cooperation in the region. There is always, and there has been a very unbalanced power in these big organizations where Mexico often has very little to say. But I would say that I really think that we will need international support for health, education, and science. Unfortunately, we've seen lots of budget cuts in Mexico and everywhere, but going towards and affecting academia, scholars, science, education. And if we want to keep on researching and trying to work with these vulnerable populations, we will need, unfortunately, support from abroad, because it doesn't seem that we will have support from the Mexican CONACYT or from other organizations, unfortunately. And I know that we will have a very huge economic impact. So everyone will have budget cuts, but unfortunately, as scholars, we have seen budget cuts already.
Well, thank you very much, Claudia. Some realism here to digest. Now we'll go to questions from the audience. There are many, many questions. Again, apologies if we don't get to them all. Really fast, Roberto, does the European Union have a specific policy to address the rise of violence against women during the lockdown? Do you know, Roberto?
Unfortunately, this is not my field of expertise. Of course, there have been reports of this. This is a very important issue which is taken care of, including at the EU level by the Commission. But I cannot really enter into the details of measures taken to address this issue.
Okay, Anna, do you have any perspective on that, on violence against women? Any measures exacerbated by lockdown? Unmute, please, Anna, unmute your microphone.
Yes, I think this is something, this is a problem that it existed before, of course, and now really in the last weeks we have seen campaigns in the cities to address that, but I think that this is not a special action now, but this is something that is, really this is a problem that is more addressed by the national states, the member states. But I think this is something that could be really addressed more in a regional manner, no? In a regional vision. But yes, I think I'm not also following this question, but really, yes, this is something that in all the perspective of the last weeks has been, because it seems that the attacks and the problems with during this period have been increasing in the last weeks. So it's really a problem. And the confinement has been really a situation that there is some emergency telephones and things like that.
Okay. Marcelo, the question of $1 million, how much time will it take for Mexico to recover from the economic crisis? Also linked to many questions that have been asked about the lack of data, because INEGI won't be able to do all the interviews, data are coming with a delay. How are we going to get out of this?
Well, regarding the first questions, I would say that there are some sectors that are very important for the Mexican economy, like tourism, for example, which is not expected to recover very fast. International flights and international travel affect tourism, and also remittances from the United States. In April, we have seen a huge increase in remittances, but this was associated with the depreciation of the peso against the dollar due to the crisis, and actually an increase in remittances. And the huge amount of people losing their jobs in the US, many of these people are actually Mexican migrants. And so that part, which affects consumption, which affects jobs in different parts of the country, will be affected during the rest of the year at least. Regarding manufacturing, for example, there's a lot of talk right now between the US government and the Mexican government to open the production of cars and trade in the automotive sector. So that sector might start producing and opening pretty soon. So it will hit Mexico differently in different regions. Regarding the lack of data, yes, INEGI has announced in the last few days that they're not going to be able to produce employment and unemployment data for 2 months at least. But on the other hand, what can be done to sort of go around the problem is that IMSS, the Mexican Institute of Social Security, start publishing weekly data about job loss in the formal sector at least. And together with other sources of information, like for example, like the CIDOB survey, that would be helpful. The problem is that the government has not been responsive to this data. The measures that the Mexican government has been taken to sort of help those who lost their job or losing income are not being implemented in the way that they should. And so most of the help of the government is the same that it was before the crisis, and goes to people outside the labor market. So that has to be, we need more data from IMSS, and we need the government to look at it very carefully.
Thank you, Marcelo. Claudia, Roberto, conditions in migrant camps are very difficult. Talking about the here and now during the COVID-19 pandemic, it's hard to keep the safe distance or to comply with all the preventive measures. What is the European Union and what is Mexico doing besides releasing people, as Claudia had mentioned, in terms of that? How are migrants and refugees going to survive this now that they're at the camps? Roberto, go first, please.
Yes, also in this on this aspect, on this specific problem, there have been some positive developments with some states also responding to calls for human rights bodies such as the Council of Europe, easing the detention regime and releasing people from detentions, especially in the case of migrants who were supposed to be returning to the countries, or their countries of origin, because currently, due to COVID, travel restriction is not possible to enforce these returns. So even the justification, the legal justification for keeping these people in detention is not there anymore. So in light of this, also civil society actors, but also human rights actors have called on states to release people from detention center and explore alternatives to detention for migrants.
Thank you, Roberto. Claudia.
Yeah, I mean, we don't have camps here in Mexico or in the United States. We have detention centers with different conditions. Many of these detention centers are not are also for people who will be deported or who are waiting for a notification of deportation. So I would say that what's happening in the United States is very problematic, because we do know, and actually ICE, Immigration and Customs Enforcement, has published data on the number of infected people, both in detention facilities and ICE officials who are infected but are not necessarily dealing with people who is detained. So it's unclear how that will play out. Some people think that actually the pandemic will be an excuse for deporting faster and deporting more people, which will be problematic, because I mean, the United States could argue that for health reasons, they need to get rid of this population, right, for health reasons. So that's problematic, especially if you think that there has already been cases in Guatemala of migrants who have been deported and that arrive to shelters that are also infected and that are spreading COVID. And the problem, I think, is not necessarily the transmission of the virus itself, but the potential increase of xenophobia and racism discrimination, thinking that migrants are just a vector for infection, right? And I think that this opens the door for anti-immigrant sentiments that we have already been aware of in all of our countries, and that unfortunately this could be just exacerbated by the idea that they're bringing COVID and they're infecting. And I'm really, really worried about the implications that this will have, because as Roberto has said, we've been working for a change of narrative in terms of migration and refugee. And this is just going against many of the ideas, and people will just use this as an excuse for being racist and xenophobic, as we've seen in examples all around the world.
Yeah, some say that this crisis has brought the best out of us, and some say that it has brought the worst out of us. In the case of the European Union, Roberto, are there any specific things the European Union itself can do to force member states to act differently in terms of migrants and refugees for humanitarian reasons? Or is it just that the states can do whatever they want?
No, of course, this is an important aspect, because the Commission as trying to foster a more coordinating response by member states in the face of unilateral and uncoordinating responses, in particular in the first part of the emergency. And I think the Commission issues guidance, for example, in the field of asylum, or stating the need to protect, to respect the right of asylums. But I think it should also be made clear that there are also consequences and that measures are taken by the Commission in case of violation, of serious violations of fundamental rights. The situation, for example, in Greece, well before the COVID emergency at the end of February, beginning of March, with practices of ill treatment and refusal of entry at the border, was already a very worrying situation. And also in that case, the Commission has instruments to start procedures against states who do not comply with fundamental principles and standards included in EU law. At the same time, as I said before, it's not just enough to condemn states like the external borders like Greece, Malta, that they are facing often a very important pressure on their system. This should be accompanied by increased solidarity and support from other member states. There are a number of proposals on the table in the past. The Commission is also working on new proposals to better share responsibility with the states most affected. And also one final note on cooperation at the international level. The EU, as many other countries, is part of the Global Compact on Migration and Refugees, even if some states decided to not to take part, especially in the Migration Compact. But the Compact on Refugees specifically about fostering better sharing of responsibility at the international level. So EU funding assistance should be directed towards those countries that are facing displacement challenges and that probably will face in the future, or there is risk they will face in the future also more difficult challenges if the virus spread also in those countries.
Thank you, Roberto. Ana, we've been looking at the situation in the European Union from Mexico. We're still in lockdown. We're at a different stage of the pandemic. What are the three main actions that the European Union will take to help people who have lost their jobs, or any other measures that are going to help people for the next step once the pandemic is controlled? Could these actions be applied to countries like Mexico?
Well, I see also a comment from a participant that said that Mexico should do their own answer because the European answer was disastrous. Well, disastrous are also lessons to learn, and I think that Europe also was very late in not looking what's happening in China and other countries, and we were late. So it's important that Mexico look what is happening in Europe now, to learn to have their own responses to the virus and the crisis. But yes, there are things that should be done now at the moment, immediately. One is to assure that people have a minimum wage. This is a debate that we have a long time ago, but now it's in Spain, for example, we are discussing that. And I think in Europe is something that I think that is difficult to translate to other countries, but I think that this is something that is in the table. The other is to to look at another reform of the taxes, the tax system, because this is we know that all these social policies are unsustainable if we don't have another fiscal pact with all the population. That is not only is a question that to be discussed with the governments, but also with private companies, no? Because this is a pact with all the society. So this is one reform that is important, and it's something to discuss in the relationship between Mexico and European Union. And it's not only a national issue, because now with this globalization, the tax reforms should be have this external way, no?
Right. Marcelo, we don't have that kind of discussion in Mexico right now, do we? About a minimum and a universal minimum wage, or any way to help the population that is losing their jobs.
Yeah, that has been a very surprising lack of response from the government regarding people who lost their jobs, people who are losing their income. The government has remained very passive regarding what's going on in the labor market. They strengthen their own programs, which, as I said before, these programs target mostly people who are outside the labor market, people, either young people who are studying or doing some training on the job, or older populations getting a pension. So there has not been an analysis and a clear response to what's going on in the labor markets. And the basic problem is, as I said, the huge amount of people working in informal sector and without a social security number or a tax identification number through which they could be reached. And that, and I think that's a challenge, the main challenge that we're facing. And in that sense, nothing has been done in that direction. But we hope that the government sort of revise their policies and comes out with a solution for this.
Okay. Claudia, I know you want to participate, but I also have some questions for you.
Okay.
One on indigenous populations. There's been a question about that. Do you have any insights on that? And a second one regarding that perhaps many of the Mexican migrants in the United States will seek to return to their communities of origin because of the situation in the United States. Will that add to the burden of the Mexican economy? Or would that be helpful for the recovery period?
Okay. So let me just add very quickly to what Marcelo was saying, because I think I agree that informality and precarious work is one of the largest problems in Mexico, and especially for migrants, we've seen an increase of labor market incorporation towards informality, and this both for foreign-born but also for returnees. And this is very problematic if we think what's coming ahead and what has happened already. Unfortunately, you could think that the pandemic will have an increase of inequality, but it's also true that in a sense it will reduce inequality, that just because everybody will be as bad as each other, right? We have observed in the last years a convergence towards the bottom, right? So salaries have decreased. The relative advantage that returnees used to have in the past has been lost. And this is something that I've been working on for a while already. We see the same pattern for US born. So we see the same thing as people having a university degree, right? So the returns to education have been lower. And this is something that has been a longer trend since 2008. We think that, and you might think that this reduction in inequality is positive because but not necessarily, right? Everybody's doing as bad. Everybody's having low salaries and bad conditions at work, in the informal sector. So I think that if we think that the pandemic will even make things worse, we need to separate what's inequality from what is kind of like the actual salary and employment informality and the levels and the trends, because otherwise we might be confusing things. I do not see return as a burden to the economy at all. I think that returnees have the potential to provide with many ideas, with work, with kind of like new ways of doing things, and they can really bring change to the communities. But we have seen so far kind of like a negative view towards these returnees, partially because they have been associated to deportees, and they have been associated to criminals in a very wrong way. And I have to say that in that sense, I personally do think that we will see an increase of return to Mexico because conditions will be really hard in the United States. We saw a huge increase in 2010 of return post the Great Recession. So we might think that something similar might happen, but I think that Mexicans in the United States are also aware that the Mexican economy will be bad. So it's kind of unclear what will happen, but you might think that they will want to sit over the crisis here. And what we saw in 2010 is that there was an increase of Mexicans coming back with a legal status in the United States. So we know that less than half of the Mexican population is undocumented, but we have a large portion that is US citizens or green card holders. And they were actually the ones that were also returning to Mexico to sit over the crisis here, because some way it's cheaper to live here, right, with a limited income. So I think that is my forecast in terms of return. I do think that we will see an increase, and unfortunately, they will be coming back to a labor market, to a society that has been hit by the pandemic. Very quickly about indigenous migrants, we have seen some accounts, especially in the United States. We are discussing a little bit more about how they are faring in the crisis. But I don't see a discussion here in Mexico at all in terms of indigenous migrants, although we are presenting actually in this report and series of publications that I mentioned earlier, a note on what's happening, for example, with seasonal agricultural workers here in Mexico, jornaleros, right, that are internal migrants. So we should also think about those populations that are internal migrants upon, forced displaced because of violence, and other populations that are not necessarily international migrants.
Okay, just a closing note from all of you. One last word, very, very short, please. Anna, what is your view for the future? What will happen after COVID-19 in terms of inequality for the European Union?
Well, I think at least the debate is open, and I think that it's the second time in 1 decade we will have this debate. So I think we should take something now in advance, because we have no more time to lose to address this question. Inequality should be now in the next years will be in the agenda of the United and of the European Union. That's sure.
Thank you. Marcelo, what's your view for Mexico in terms of inequality after this?
Well, during all the previous crises in which Mexico has been involved, poverty increased and inequality increased. And this was a source of, and in many cases, this meant falling into poverty forever. We have a very low social mobility in Mexico. A large percentage of those who are born poor remain poor all their life, and this is again a new occasion for worsening things in terms of social mobility instead of creating the context of reducing poverty. So the measures, the estimates of Coneval they make us pessimists in terms of the outcomes from this crisis.
Thank you, Marcelo. Roberto, a better European Union in terms of inequality, migrants, refugees after this, or not really?
Yeah, I want to try to be optimistic, and of course the hope is that the measures that are being taken by government to flatten the curve of the epidemics, to address the blows to society of economic and social level are going to work. So at the same time, it's important, as I stressed before, that some red lines in terms of the core of national states, including in national state constitution, in new treaties, including the rule of law and respect for fundamental rights are upheld. So the challenge is to respond effectively to this emergency while at the same time upholding these foundations of our democracies.
Thank you, Roberto. Claudia, after COVID-19, more migrants, more Mexican migrants, more Central American migrants trying to get to the United States despite it all, or not really?
I don't know. I think right now, everybody is on hold. We've seen a huge reduction of movement. I think there will be more barriers and for movement in general, for migration. The United States will definitely use this as a moment for actually doing what President Trump wanted before the campaign. I think, unfortunately, there will be people in the need of leaving their home countries, but at the same time, very adverse conditions surrounding migration and refugee. And I think we were working on trying to change the narrative towards migration and asylum and refugee, and this has kind of gone taken us back. But I'm really, if we want to be optimistic, let's hope that at the same time we will just have a change of thought of what is important during all this time staying home and confinement.
Well, perhaps the sense of vulnerability that we all face now, perhaps more than ever before, can help us think about those who are vulnerable all the time and are more vulnerable now because of COVID-19. Well, thank you very much for this discussion that throws some light on the tasks ahead, particularly in the European Union and Mexico. We thank our audience for joining us, and please answer the survey that you will be sent by email, and see you here next Tuesday, same time, same place. Well, you can change rooms if you want, but we'll be here for yet another conversation on COVID-19 related to what the European Union and Mexico are doing and can do together. Thank you so much for joining us. Bye-bye.